Okay, so clinicians treating patellofemoral pain syndrome should know the latest evidence supports using progressive loading exercises. This gradual loading slowly increases patellofemoral joint tolerance to exercise and activity. However, to understand which progressive loading exercises to give patients, clinicians need to know the three types of load placed on the patellofemoral joint. So if you look at total load, the total load or the loading index for each patellofemoral joint exercise is based off three variables. And that's going to be the loading peak, which is going to be the max force that's going to be applied during an activity or exercise. The loading impulse, which is going to be the total amount of time the joint is loaded. And then the loading rate, which is going to be the speed at which the load is applied during an activity or exercise. Now, it's also really important for us to understand how to progress this load for runners. Runners need to progress loading peak, followed by loading impulse, and then followed by loading rate. The reason for this is because many runners suffer injuries that are due to high impact. We know running is high impact. So the last thing we want to progress is the loading rate. We want to progress exercises that we know the patient will tolerate, or at least we have a good feeling the patient will tolerate first. That's going to cause minimal pain, minimal flare-ups, minimal inflammation, and then we can progress towards the loading rate. So, before we go into the specific exercises for each and go through a detailed ranking system of all the patellofemoral joint exercises, I first want to give a couple examples here so you can get loading peak and impulse and rate kind of in your head and get a better idea of what they really entail. So good examples of high loading peak are going to be deep squats for a patellofemoral joint, or a single leg forward hop for an Achilles. And for patellar tendon, this was actually really interesting. Decline squats really put the most loading peak on the patellar tendon. So that's a high loading peak exercise. Now again, as I mentioned, we want to progress the loading peak first for runners. Then we want to go towards impulse. So the total amount of time that exercise is going to take. Now for patellofemoral joint pain, we don't oftentimes see high loading peak with a high amount of loading impulse and loading rate. We kind of can see these variables interchange a little bit better. But for loading impulse, the total amount of time, good examples of this would be isometrics under heavy load. For example, a 45-degree squat, maybe even a 90-degree squat for the patellofemoral joint. An isometric heel raise, especially under high weight, high load. And then slow isotonic exercises also have a pretty high loading impulse as well, because the total amount of time those structures are under tension or under load is quite considerable during the slow contractile movements. So loading impulse is the next thing we progress for runners. And then finally, we get to loading rate. This is commonly going to be things like our plyometric exercises. We could even call this running, which we already talked about. And good examples of this would be things like a rebound jump or a drop jump. And we can know that a drop jump is going to have high load for the Achilles tendon, many other structures as well. So we really want to wait towards the end of rehab to progress the loading rate, because we know that that's going to be a hard thing and a highly risky thing for runners to progress to, knowing that that's oftentimes the origin of their injury to start with. Now let's go through which exercises you should give in order for patellofemoral pain syndrome and their corresponding loading peak, impulse, and rate.